now we're into the segment we call What's Up, Doc, where we spend some time with the experts in healthcare at Mercy Health. This morning, of course, no exception. We're spending some time with Dr. John Pakiela, and he's on the line with us right now. Dr. Pakiela, good morning to you.
Good morning, Riley and Joe. How are you guys doing?
We're terrific. We pronounce your name correctly, sir?
Yes, you did.
Good to know.
I told you I had it right.
Yeah, it's not a matter of not trusting you. It's, well...
sorry, Doctor, you had to hear us fight like that.
Yeah, we'll put it together. Tell us a little bit about you, Doctor.
Well, I've been an emergency physician for 20-plus years here. My background is in critical care transport. So when I was... Before I went to med school, when I was a young child, I used to watch the show Emergency on TV, and I either wanted to be a firefighter or an emergency physician. So I actually did both. I was a volunteer firefighter in Pennsylvania. I went to med school, became an emergency physician, and then I started flying as a critical care flight physician out of Cleveland Metro Life Flight in Cleveland, Ohio.
Wow.
There I was the medical director and chief flight physician for about 7 years there. And got a lot of experience in critical care transport. So came out to Rockford about 6 years ago, and now I'm the medical director for Mercy Health React. And I also work as one of Mercy Health's MD1 EMS physicians. So we actually work in the field doing field emergencies with our police, EMS, and fire agencies that we work with as well. So we respond, with our ambulances in the field. So, my background is a lot of pre-hospital medicine in addition to emergency medicine.
Yeah, it sounds like you get a day off every 6-8 years, something like that?
Yeah, that's usually it. That's usually it, especially with COVID.
So you've been all over the country. How did you wind up in Rockford?
Well, what attracted me to Rockford was actually the flight program and the EMS program that Mercy Health has. It's very unique in that we have physicians so involved in the pre-hospital part of medicine, and we're actually, in the field practicing, as emergency physicians in the field. It's like my old flight days, but, without flying in the back of the ambulance, I have a Chevy Suburban that I bring to the scene. So, Mercy Health React is our critical care component of our system at Mercy, and I work with our critical care nurses and critical care paramedics to make sure we're providing excellent patient care.
Fill us in on what goes under the entire umbrella of Mercy Health React.
Well, Mercy Health React is a single aircraft. We have a Eurocopter 145, a couple years old aircraft. Great service, great great avionics. Cruising speed's about 150 miles an hour. Weight, once it's filled up, it's about 8,000 pounds of equipment and everything that's on there besides the airframe and everything. And we've been providing service to the area and the region for 34 years. Actually, we started in September of 1987, so this is our anniversary this month, and 34 years of service and thousands of patients served.
You mentioned that one of the unique things about the Mercy Health program, and I believe you said the pre-hospital attendance by the physician, that seems to make sense if I'm understanding what you're saying, that the physicians go out to the field to address it at the scene. Other hospital organizations don't send physicians out?
Not in our region, and in some of the bigger city areas, there are physician-based response programs. But in Rockford, there's no other physician group that goes out in the field. We're fortunate enough to have that support from the hospital system, to have that resource. We also have physicians that respond in Janesville, Wisconsin, as well as Walworth County, Wisconsin, as well. And the helicopter works to support those needs as well. On the helicopter, it's a flight nurse and a flight paramedic, but, working with us and all the other local folks in the field. For us, within, a 25 to 30-minute radius of the call, if we're available, that's a good time for us to, get to the patient and provide resources. Oftentimes we work with the helicopter as well, but, getting past that, 20, 25-minute drive time, the helicopter becomes the primary service to get, out into areas that have critical needs that are time dependent.
It's amazing to consider the amount of lives that have been saved with the implementation of this technology and the helicopters and the teams that are working on it. Patients that years and years and years ago, and we didn't have that sort of transport at our fingertips, we would have lost.
Correct. Now, medicine is, the first big kind of team thing that was developed in medicine was the trauma team concept, and that came out of the Vietnam era with helicopters, actually. We had the Hueys in Vietnam that would go in and, take these injured servicemen to aid stations, to surgical stations, and then they'd have, quick repair of their injuries and stabilization, and then move down the road to more definitive care. So that has kind of expanded from not only trauma, now we have stroke teams and heart attack, or we call them STEMI teams, ST elevation, myocardial infarction teams. And those are very much a part of our business as well now. We have a comprehensive stroke center at Mercy Health. So we see many stroke patients that are out of the window for the traditional clot-busting medication that's used, but then they can be flown to Mercy Health, and Dr. Bansal, who I believe you guys have interviewed before,
yep,
does intervention on them and retrieves the clot and has great outcomes with these patients. So, these are people that live in rural and underserved areas medically. They may be an hour and 15-minute drive away from Rockford, but they're getting that level of care brought to them in the helicopter, and then the helicopter brings them to the tertiary center at Mercy Health for their care.
Who makes the call that the chopper has to go out?
Well, it depends on where we're going. So we have two different types of responses. So we have what we call a scene response, where we would land somewhere in the field. So we land on a highway, we land in a school playground, we land in a cornfield somewhere. And that call is made oftentimes by the police department or the sheriff or the state patrol that's on scene, in conjunction with the fire and EMS personnel that are on scene. A lot of that initially is based on mechanism of injury, how many patients, what the initial reports are, because usually the police are the first ones on the scene with these, and they can give reports as to how bad things are at the scene. And if the patient is in the hospital, that's about 80% of what we do. Then the caring physician or the treating physician makes the call. What's the right resource for this patient? What do I need? Number one, what kind of care do I need? What level of care do I need for my patient? And then what resources can they bring with them? And then also the speed is a big factor as well. So if it takes you an hour to drive somewhere, it takes us about 20 minutes to fly that. Because again, we're as the crow flies without traffic lights and other things. So we're able to get in and out quicker, especially longer distances.
And you guys are going 150 miles an hour.
Correct.
Is that you said cruising speed? Is that I'm ignorant of terminology? Is that just what the helicopter gets to on most trips, or is that just the max speed?
Yeah, I mean you're not pushing the envelope on every trip, but it depends on the winds and it depends on what you're doing. But that's about the cruising speed. When you're out and about and going from point A to point B, you're in that range.
I was thinking, it takes an extraordinary amount of training to provide emergency care as it is. What goes into doing it on a helicopter and doing it on the field as you've been flown there by a helicopter? It seems to me we're adding a lot of components to this.
Well, yeah, exactly. It's a lot of training. You're working in a very small box, if you will. Whether you're in the back of an ambulance or the back of a helicopter is even smaller. And it's a very austere environment, and there's no one coming. You're it. There's no one else coming to help. You are the resource there that's going to be the highest level of care. And you have a bad airway or a bad situation or somebody who's critically ill. It's just you as the flight nurse and the flight medic in the back of that box, handling the patient. And doing, using the resources you have and the capabilities that you have to take care of the patient and to stabilize them, resuscitate them, and get them to the appropriate facility.
Doctor, I recall over the winter watching the React helicopter fly over, and I think ground level temperature was about 5 above zero. We had a wind chill going that was in the teens, below zero, and all that. What's the environment like in the aircraft when temperatures are like that?
Well, we have to keep the patient warm. That's the key here. And we do have a heater in the aircraft. The aircraft's hangared when it's not out on a mission, in the winter. And then when we start up and get flying, we have that heat. But we also have a kind of a space blanket. It's the similar concept to what the astronauts use in space. And then we try to keep the patient warm with warmed IV fluids, warming packs as well. But yeah, it can present a challenge not only for the patient and keeping them warm, but medication, pumps, strips, things like that, to try to prevent that from freezing as well.
Yeah, it doesn't help if you can't move your fingers.
Correct. Those are hard flights.
I've fortunately never been in a medical helicopter myself. I have. I've been in an ambulance a time or two. I'm a little accident prone here and there. Would do they resemble each other? I mean, is it just a smaller version of the back of the ambulance? What's it look like in there?
It is a smaller version. Everything has a purpose in the back of the helicopter, and it's put in the similar place for the right reason. So, everything is arranged for maximum exposure of the patient, so we can have access to them and continue care in flight. So the person that's at the patient's head will have all the airway equipment right near them. So if the patient needs an airway or needs continued airway monitoring, all that equipment is right there. If they're on a cardiac monitor, a balloon pump, the heart-lung machine, ECMO, those things are all placed strategically in the aircraft so that the crew has access to monitor those and then make appropriate changes as the patient's condition changes. So, yeah, it's very much a small space. You can't... we don't have a lot of hoarders, as so to speak. Paramedics and nurses in general like to have lots of this type of equipment or lots of that type of equipment. We have to kind of really go and look at exactly what we need on each mission, and have that available for the patient.
Doctor, how far is the reach? How far out from Rockford do you go? North, south, east, and west?
So we serve all of northern Illinois and southern Wisconsin, and we go as far east as as far west as eastern Iowa, and then as far east as Chicagoland area. So we have a pretty good radius to get out to.
Wow, I didn't know it was that big.
Yeah, that's big.
And obviously you guys will go out whenever needed. But what's an average week for you? Are you guys going out every day, multiple times a day, once a week? What's your usual schedule look like?
So it depends on the week. Usually in the summer months, it's usually busier. With the trauma season. Historically, trauma season runs from Memorial Day through Labor Day, so we're kind of at the end of that. But anytime people are out and about, trauma is the big thing that we see. As we get into the fall and the winter, traditionally it's more medical cases and things. But COVID has definitely thrown a wrench into a lot of the timing of a lot of diseases and. We're seeing a lot of respiratory illnesses in children that we usually see in the fall. We're seeing them now. It just depends on the day. We're usually doing, a couple a day or a couple calls a day. And then when we're not flying for patient missions, we're also going out and teaching and training. So we'll land at a fire department. We'll do a helicopter safety class. We'll teach them about trauma management and resuscitation. We'll go to a smaller community hospital and teach them OB. And we have Mercy Health has a simulator program where we have, for example, we have an OB simulator. So how often do we get to do, deliveries in live patients at smaller hospitals? That's not a common occurrence. So we bring out our simulator, and our crew helps teach those providers how to take care of high-risk deliveries and how to manage those. And then, we're the ones that'll end up transporting them back to Mercy Health to the neonatal intensive care unit or to the high-risk OB center.
It's a fascinating look at a part of medicine and what healthcare professionals are doing that a lot of people know a little bit about on the cruise. I mean, we've seen it fly over. We know there's a helicopter, but you've enlightened us as to a lot of things I don't think a lot of people were aware that you're actually doing.
Oh, thank you.
Yeah, that's pretty amazing, and we're lucky to have a service like this. We're lucky to have a service like this. We're lucky to have a doctor like Dr. Pakiela who's done it all and continues to do it all and teach others how to do it as well. Is there anything about Mercy Health React or really anything else that we haven't asked you that you wanted to make sure we got out there for people?
No, I think I just want to, at this point, we're very appreciative of the hospital system for the resources that are provided to us. We provide cutting edge care. We have blood and plasma on every flight. We do high risk OB. We do those very small babies, those neonatal intensive care transports. We do balloon pump flights and the heart-lung machine, the ECMO machine. And we have bedside ultrasound that we use as well. And all of that level of care and that level of training wouldn't be possible without the broad support that we receive from the Mercy Health system. They've invested in our flight program. Again, we've been here for 34 years, but we continue to grow and continue to maintain that excellence and operate at the highest level. So, we couldn't do that without their support, and we truly appreciate that.
And we truly appreciate you, Dr. Pakiela, for carving out time on what we know is a very busy day, is a very busy schedule, seems to be a very busy life. But we appreciate you enlightening us. This was really cool. Have a great rest of your day.
All right, thanks, Riley and Joe. You too, and it was great talking to you, and I look forward to talking to you again soon sometime.
I would love that.
Welcome.
Would love to have him back. That's Dr. John Pakiela, and he is with Mercy Health React, and a good guy to have aboard.